So I have the pleasure of introducing Dr. Patrick Lee. Dr. Patrick Lee is the inaugural chairman of medicine for One Book on Health. Dr. Lee has dedicated his career to solving two problems: helping individuals and teams reach their fullest potential and creating health systems that deliver safe, kind, and timely care. He joined One Book on Health with the aim to make a direct and meaningful contribution to racial justice through better health for patients and their communities. Dr. Lee earned a BA in English from Princeton University and his MD from the University of California, San Francisco School of Medicine. He completed his residency training in internal medicine and primary care at Massachusetts General Hospital, a fellowship in medical education at Harvard Medical School, and holds an advanced diploma in tropical medicine from the London School of Hygiene and Tropical Medicine. As chairman of medicine at Mass General Brigham Salem Hospital, Dr. Lee led the Department of Medicine's response to the highest COVID-19 patient volume among community hospitals in Massachusetts. Among his previous roles, Dr. Lee served as Chief Performance Improvement Officer for a large federally qualified health center in Lynn, Massachusetts, where his efforts in improving population health contributed to the health center receiving 2 national quality awards from the U.S. Centers of Disease Control and the U.S. Health Resources and Service Administration. Dr. Lee served as founding program director for the Global Primary Care Residency Program at Massachusetts General Hospital and co-founding course director of a popular global health course at Harvard Medical School. As medical director at Last Mile Health in Liberia, Dr. Lee supervised the national scale-up of an HIV community health worker model in partnership with Liberia's Ministry of Health. Dr. Lee's scholarly interests focus on primary care systems, quality improvement, and medical education. He has published his work in the New England Journal of Medicine, the Lancet, the Journal of General Internal Medicine, and others. When meeting Dr. Lee, I was struck by his very unique combination of being a healthcare operations maven who communicates like a poet laureate. So please help me in welcoming Dr. Patrick Lee.
Thank you so much, Elka, for that very, very kind introduction. Thank you, Teresa. Thanks to all of you. And it's such a privilege to be here with you today, and really an honor to follow such thoughtful and really well-framed presentations. So it's a great honor to be asked to share some of these ideas with all of you today. This is a bit of a different talk. It is based on a paper that was published in the Journal of General Medicine that actually had an 8-year journey. This is one of those articles that I tried to write and failed again and again and again. In parallel with the journey in which I continued to try to reflect and learn and find my voice as a leader and try to pull together a range of insights and wisdom from my own mentors and colleagues. And finally, as I began to find that footing, Dr. Jackson at JGIM took pity on me and agreed to accept this article publication. So it's a very short piece, but it forms the frame for today's talk. With complete humility that this is just one view on obviously a very important and broad topic. I will share some of the things I've learned and gathered over time in case any of them may be helpful to you. In the framework of professionalism and inclusivity, I think the way to think about this talk is that each of us have a role shaping the environment around us as leaders. And depending on our place in the hierarchy and the relative power we wield, the shadow or the light of that role is broader. And that is what often contributes to hidden curriculum, the sense of safety, the sense of inclusivity. And so this is an angle on what our responsibility is in contributing to that learning environment as leaders. Please feel free to throw your questions in the chat as you go. I have about 45 minutes of remarks, so hopefully we'll have plenty of time for conversation at the end. So with that, Let's get into it. So the article is Leading with Love, 5 Practical Tips. And you can see the reference there in the bottom left. This is the outline of the talk. I'll start by making the case for why love matters and what that looks like in organizational terms, and then go through these 5 tips with a few ideas under each to focus on the people, to develop a culture of professional diastole. I'll define that term when we get to that point, to foster relational trust by reducing the vulnerability of others, to make sure the right people are in the right seats on the bus, and to administer policies with kindness and common sense. So first, love. So this story really begins when a friend of mine shared with me this interview from Fitzhugh Mullen of Avidus Donabedian toward the end of his life, published in Health Affairs 2001. I highly recommend the read if you haven't seen it already. And Donabedian, of course, is one of the people who is credited with bringing a discipline to systems thinking in healthcare. If you've heard of the framework of structure, process, and outcomes, this comes from Donabedian, so a giant in the field of systems thinking. But this was his quote in Mullen's interview. He said, "Systems awareness and systems design are important for health professionals, but are not enough. They are enabling mechanisms only. It is the ethical dimension of individuals that is essential to a system's success. Ultimately, the secret of quality is love. If you have love, you can then work backward to monitor and improve the system." And I remember when I read this line, I sort of put the article down because it just sort of struck me as self-evident. It struck me with a certain moral force, and it seemed so eminently true, but I hadn't really conceptualized it in that way before. I've never done it the same way since. So the secret of quality is love. I really believe that assertion from Donabedian. This is another way that I had been thinking about, I think, very similar issues. You'll notice that probably as I go through this, you'll think of other concepts that land in the same general space. And so, language, as we heard in the previous wonderful presentation, really matters. And so this is just another way that I have come to understand this space. So this painting actually comes from rural Liberia, and there's a brief story behind it. So I was the medical director of Last Mile Health. At that time, it was actually called Teatine Health, Teatine being a word in the local Kron dialect in Liberia that means both truth and justice in health. So I was the medical director of this organization. It's a sister organization of Partners in Health, and we had just implemented our first 50 community health worker directly observed therapy for HIV and TB program. When the Ministry of Health approached our team and asked us a question, they said, the Global Fund is here and asking to partner with us in a much more significant way, together with robust funding that we are really looking to pursue. And to do that, we would need you to scale your program from 1 site to 19 sites across the whole country in 18 months. We trust you as a local organization. I should say, as a background, that the founder of our organization is Liberian and had worked with the Ministry of Health to frame their national health policy after having received his training at Hopkins and UNC after fleeing the country as a child. And so he was trusted. And they said, we trust you, please consider this. So we were having this conversation as a team. It just happened to be that at that time, unfortunately, our local Liberian leader had embezzled most of the organization's funds. And the idea, we'd brought over cash in suitcases just to be able to pay our community health workers. So the idea of scaling this program to 19 sites in 18 months seemed crazy. The possibility of failure seemed far too high. And obviously that would be bad for many reasons. And yet the mission of the organization, this truth and justice in health for all Liberians in partnership with the public sector, advancing the capability of the public sector, this was the core of our whole reason for being. This was the sweet spot. So it was in this moment, I'll never forget, that one of our women leaders, Rebecca Amara, she stood up and put her fist on the table. And she said, "We are strongest when we are one trunk, many branches." And I learned 2 lessons in that moment. I learned first that Liberian women, when they have something really important to say, will often speak in metaphor. It wasn't the last time, and I'll never forget this one. And the second thing I learned is really this beautiful metaphor. The trunk, of course, is our shared values, our core mission, the reason why our team exists at all, and it must be deeply rooted. It is fundamental. But the branches are all of our individual wholeness and diversity, our backgrounds, our experiences, our perspectives, everything that we bring to the table. And these should not be collapsed into a stormtrooper homogenous center, but rather should be encouraged to really flourish, provided they can remain connected to each other and to the whole, to the trunk. And this, of course, is the work of leadership, the work of leading with love. So these concepts of the secret of quality is love, and we are strongest in your one trunk, many branches, these really became poles, if you will, as I began to try to understand this space. And as I've continued to work with these ideas for a number of years, it's become clear that actually these concepts are self-evident, to all of us. So if we imagine the experience of being a patient or being at the bedside of a loved one or a friend who is a patient, and someone comes to the bedside to provide some sort of service or care, if you reflect on that moment, we actually know almost right away whether that person who is coming is there to complete a task, to accomplish a piece of work, or they're there in a capacity in which they really care. They notice, you look worried, and what's on your mind? You seem cold. Can I get you a warm blanket? And then they actually bring the blanket. We know, and it makes all the difference. And this is the fundamental thing that changes our experience and our trust in that moment. As a team member, we understand when a team member is basically transacting with us. This is what I need from you. This is what you can expect from me, and vice versa. And let's meet expectations. And of course, we want that, right? That is important. There are, of course, examples where that doesn't occur, and that's even worse. But it's a little different, actually, when you're with a team member, and you can probably reflect an experience like this, where maybe you don't see something the same way, but your team member leans in. And, I really want to understand how you see this. The way that you think about this matters to me because you matter to me, and I'm open to your thoughts. Or they remember that, this is the anniversary, of your wedding, or they follow up on your ill family member to see how you're doing, how they're doing. It makes entirely a different working or learning environment when you're working with that team member. It transforms a relationship. From a leadership perspective, how many of you have had the experience where a leader reaches out or shows up and really you kind of know that they're just sort of checking in to see how productive you're being? Like what have you done for me lately? What are you accomplishing for the organization, for the team? And of course, that's very much part of the leader's job. But you've also probably experienced a leader who shows up and actually seems to want to get to know you. Who are you? What matters to you? What are some of your aspirations? How can I help you in your journey? What do you think? How do you see this? What am I getting wrong? What would you advise? You matter. You're part of this, not just because of what you can produce, but because you're human and because I care about you. And we show up differently for a leader like that. We bring more of ourselves, not because they make us do it, but because we want to, right? Because we feel seen, we feel cared for. And then, of course, in our personal lives, as friends, as family members, as parents, and so on, these concepts clearly resonate. So what about organizationally? So what is love in organizational terms? And I would offer the idea, and it's just not a firm definition, but just a way of thinking about this, that love can be seen potentially as the sum total of the communications, the policies, the actions that together create this atmosphere of safety in the workplace. It sounds like culture of safety. It is the culture of safety, right? But what do we do as leaders? How can we think about this concept to really do our part to contribute to the kind of environment we want to see? The goal should be that every person in the organization feels deeply cared for and able to grow and succeed in their work. And a concept I really like is this concept of a cascade of caring. So, as a leader who may have hundreds or thousands of people potentially, or even even dozens of people, who you're responsible for, it can be hard to imagine, conceptualize those interpersonal communications, but you don't have to necessarily own all of that. Your job is for each of the direct reports, the people who you were directly supervising, responsible for, to care for them in a deep and personal way. And to expect in turn that they do the same for their direct reports and on out to the very front of our learning environments, of our care environments, so that our people at the front of those places where we meet our customers, we meet our patients or our students and so on, that those individuals feel safe. They feel deeply cared for, and in turn, they can cascade that to our patients. They astonish our patients with the kindness and dignity of their care. That is how this works. So if we accept the sort of premise that love really matters and that it matters in organizations and it leads to the results that matter the most, how then do we do that? And this is not a comprehensive or a perfect answer. It's just my personal journey. So tip number one, and perhaps the tip that really encompasses everything else that follows. Many of these concepts are sort of interdigitating, as you will see, but focus on the people. Really let kindness be the first principle. And as a student of lean thinking, I've come to really bring these things together with the first pillar of lean thinking, which is respect for people, recognizing the human side of change is ultimately what gates the technical side of change. And is one of the things I love about lean thinking, that it understands that comes first. So, just to sort of state perhaps the obvious, because we are human, we need and we deserve to understand the why behind decisions, especially important decisions. We have to have our voices heard when those decisions directly affect our work. We deserve to have the tools and support we need to be successful. The work is hard, but we should be set up for success so we could do a good job and go home at the end of the day feeling successful. We should have the opportunity to grow professionally in our roles, and we should ultimately feel fulfilled by our contributions to our patients, our team, and the organization. So how do we do that? And again, this is just one set of thoughts. So in my current role, these are some of the things that I do. And I thought I would share a quote from one of my mentors, Ed Hundert. He was leading at that time the Fellowship of Medical Education at Harvard Medical School. He's now the Dean of Medical Education at Harvard. And he has this wonderful quote that's actually from one of his mentors. And I'm embarrassed to say I can't remember which of his mentors shared this with Ed, but I think of Ed when I think of this quote. So Ed shared that love can be thought of as the quality of attention that we choose to give, the quality of attention that we choose to give. And so these are some of the ways that I choose to give that attention. I really think of the time that I take to listen to people and to coach, as I'll touch on later in this presentation. I think of that as time well spent, as a quality of attention that I'm choosing to give, using that time in that way. I make time in part of my leader standard work each week to block out 2 or 3 hours to shadow one physician in the Department of Medicine at One Brooklyn Health, one-on-one. And I really do my best to be respectful in the background, to frame this as a learning opportunity. I get to learn from them, see what they struggle with, see what's amazing, understand where the rubber meets the road. I almost always see lots of amazing things to praise, which can feel really nice, I think, as a frontline physician to hear that. Oftentimes there is a time-saving epic tip, which I'm able to offer that may save them a number of clicks multiplied over thousands of repeats. That often brings a smile. And then I take the time to write a handwritten thank you note afterward, reinforcing the things that were amazing about what I saw. And I've noticed that after doing this, the relationship with that physician is never the same. When we see each other, I feel differently about that physician, and they often feel differently about me as well. It is safer, and they feel seen and appreciated, and they spread the word to others. So that's one thing that I invest the time in. I also have chosen, because we have 228 residents at One Brooklyn Health, split across 2 large residency programs in 2 different hospitals that were not previously on one team, and we're trying to merge and create an integrated department. So there's a strategic interest here, but I've chosen to host all the chief residents from both sides at my home each month. I feed them a delicious meal, and then we talk story together. I'll define talk story a little later on under the Downstate section, but this is engaging in some meaningful dialogue that gives them a chance and permission to process some of what has been difficult and some of what has been fulfilling and amazing about their jobs. I will note that everyone notices how you spend your time, and the higher up you go in leadership, the more true this is. And this is how we show what we really value, because time is ultimately the most non-fungible resource that we deploy, and we should deploy it with great intention. We should choose to give this quality of attention in a way that fosters the atmosphere of safety and caring and love that we seek to create. I wanted to make sure to take the time to offer this one very practical tip. And for those of you who know this well, my apologies, but I did not know this well. I got this wrong for a long time until someone finally helped me see where I missed. And so this is one of two, like if you just remember this one slide, so this will be worth your time if it's not something you already do. So what is active listening? This is making sure that someone really feels heard, especially when the topic is important to them. So key points, and apologies for going through some stuff that may be very straightforward, but you should really listen. Your body language really matters. Don't interrupt them, right? And take notes, either mentally or on paper. Now, I did those 3 points pretty well, but what I got wrong is that I just did not interrupt somebody. And the moment they finished talking, I had all these ideas in my head and I was ready to go. And I would just jump right in on my track, just sort of, immediately going to what I want to do next. And sometimes even I had been thinking about that for long enough that I went straight from A to C or A to D rather than even spelling out the order. And it was often very disorienting for the person I was with and didn't accomplish the goal. So here's the key for me in active listening. When somebody finishes after you've carefully listened, ask permission to reflect back what you heard. This is really important. Is it okay if I reflect back what I've heard? And then I will read off my notes, summarized, or what I took mentally, and ask, what did I miss? And listen, and then reflect and confirm and go again, listen again, until I get to that point where I can literally see, when I get it right, because I'll see in the other person's body language and demeanor that they really feel heard. For those who've seen this, it's kind of remarkable. You just see someone sort of melt in front of you and let you in. And the science actually behind this shows that no matter what happens next in this interaction, the chances are now much better that this person will experience this interaction as positive, as high trust, as caring, and they will walk away from this interaction with a greater sense of safety in our interaction, even if they don't necessarily get what they want. So active listening can be transformational if you don't do it already as a habit. And I believe doing this one thing well will improve your leadership effectiveness. It certainly has for me. A huge topic, obviously, in case you want to read further, if you haven't seen it, Bob Chapman's book, Everybody Matters, The Extraordinary Power of Caring for People Like Families, an easy read. I think it's a fabulous read. And then interestingly, having been a student of lean thinking for a while and practicing respect for people, but never really having a way to measure it, I've been fascinated and really interested in Jody Hoffer-Gattel's work around the relational coordination index, which measures these 7 dimensions of relationships and communication. Do we have shared goals, shared knowledge, mutual respect? Is our communication frequent, timely, accurate, and problem-solving focused? Without giving away too much of the punchline, there's a linear relationship between the score on these 7 dimensions between and within teams and how many planes crash, how many people die in hospitals. It can be measured and remeasured. And so we are going to begin piloting this in our own medical ICU at One Brooklyn Health. And I'm excited to get to work with Jody and her team and learn from this really cool next step in being able to improve in this particular area. On to tip number 2, develop a culture of professional dastardly. So I was a senior resident at Mass General when one of my mentors, Dan Hunt, asked me this question. We had finished our mentoring session. I had set up my hand on the doorknob and he was, shooing me out the office. And he said, actually, I just want you to consider, Pat, what does professional dastardly look like for you? Okay, I'm sorry, I got to go, right? And just that was it, left me with a question. It's been years, many years since then, and I'm still reflecting on this incredible question Dan asked me, and I actually never heard him define it for me. So this is, I'm not sure this is what he meant. I think it is, but I will share with you how I've come to define this. So systole, of course, is when the heart does its work for the rest of the body. It's a pump, it moves the blood to the rest of the body. But the pressure in systole is so high that blood is not actually flowing down the coronary arteries. It's in diastole that the first branch off the aorta begins to perfuse the heart itself, and the chamber fills for the next beat. The heart does this beat to beat about 10,000 times a day. And if it doesn't, it fails and we die. So what does that mean? What does that mean as a metaphor for busy professionals like us? Another way that I've sort of kind of boiled down the concept, this is actually a very brief poem that I was invited to contribute to the Auscultations Journal at Cambridge Health Alliance, which is the in-house literary journal when I was the medical director of one of the teaching practices there. So it's from a little over 10 years ago. Our hearts are wise. They know to fill before they pump. Without diastole, they fail. What then of our lives? So what do we do with this, right? So obviously the heart spends about 2/3 of its time in diastole. We don't have time for that. And I will share that the good news is that diastole professionally is less about the number of minutes or hours you spend doing it versus the intention that you put into the moment. And I'm going to share with you some very brief examples of things that don't take a lot of time. So I will share that when I type my password for Epic, or actually also for Outlook, which I do innumerable times, every day, this password is the word kindness. Now it is highly permutated, so you couldn't really crack it. It has all the features that make it secure. But in my mind, in my head, as I type this password again and again and again, I'm sort of intoning kindness. And I'm reminding myself throughout the day of my most important core value and my most important value that I bring to the organization, kindness. I have taught myself since I was a medical student that when I'm washing my hands, so when I'm using the Purell and going in and out of a patient's room or just down the hallway as I'm making rounds, I'm saying in my head, remember your humanity. No one sees me do it. Doesn't take any extra time. Remember your humanity. But it calls me back to the core values, the reason why I chose this pathway, this profession. And I believe that I show up at the bedside or with the person I'm speaking to next. More often, I show up in that way. And occasionally, I can notice that someone experiences me in that way. So throughout the day, I'm doing this as well. It takes no time. This 5 minutes at the end of the day, this was something shared with me by one of the interns on the Mass General Bigelow service when I was attending there, and I shared this concept of dastardly with him. And he shared with me that at the end of his day, after signing out his list, signing out his pager, no more work to do, he would pick one patient at random from his list and go back to the bedside and sit down with that patient and just talk. No medicine, no agenda, just talk. And he said that was often the best 5 minutes of his day. And then for those of us who run a lot of meetings or in a lot of meetings, you could consider hardwiring in an agenda item at the top of the meeting. Does anyone have a gratitude they want to share? Is there a brief poem or a quote or a patient story that speaks to what we must change, what we must do better, or what was amazing that that we are so glad to do and need to do more of? So you can hardwire these things into the meetings that you have to do. And speaking of hardwiring, I've really been a fan of James Clear's writing in Atomic Habits, also a good read. Similar to a talk like this, James doesn't offer a great deal of new knowledge, but he pulls together what we've learned about habit formation from decades of research and presents it in a very clear and succinct way. And one of the tips that he shares is called habit stacking. And this is the basic formula. You take something that you have to do or that you're already doing all the time, and then you hardwire it to something that you want to do. And then you practice and you myelinate these two things together until it becomes a habit, until the activation energy is gone, and actually it's hard to break the habit, and you get to do the things you want to do and eliminate the things you don't want to do. So you can think back, the epic password, kindness, washing hands, remember your humanity, and so on. All these things are habit stacking. Something I want to do, diastole to something I have to do. So that's sort of the personal, professional diastole. Because this concept can really permeate and have such value when it gets going, I wanted to kind of broaden out and share a bit more of an involved structural team diastole example. So this is from Lynn Camille Health Center, where I was the medical director and the chief of performance improvement, and was responsible for leading an interprofessional team through EPIC implementation. So over 8 months, 6 different primary care teams, medical directors, nurse managers, quality folks, IT team members came together to define a new way of delivering primary care, working with our team, standard work, observing our patients, et cetera. And when we finally launched, we went from a same-day encounter closure rate, where the clinicians were actually finishing their notes 30% of the time, staying up all night, calling IT at 3 in the morning saying, the EMR is down, I need to finish my charts, to a place where we finished 80% roughly of those charts on the same day and 95% within 3 days. We scaled up to full volume 2 weeks ahead of schedule. Morale went up. There were no union complaints, even though we were a unionized shop, and changed everybody's workflows because of the way we did this together. It was a rousing success and led the organization to shift its whole strategy toward lean thinking, lean management as its main approach to improvement, to accomplishing its mission. But it was tiring. When 3 months had come by after EPIC implementation, we still landed all the workflows, the team paused to reflect and realized that now was the time to introduce the concept of team diastole. So this is the top few lines of our revised charter for the Primary Care Clinical Oversight Group, or PCCOG, which was this group. And I highlight this one section where the team creatively actually defined systole meetings and diastole meetings. And so in a systole meeting, the goal was to create and spread best practice workflows across primary care. But then in a diastole meeting, the goal was to learn from our experience, to take the time to reflect on the joy and purpose of our work, and that by balancing systole and diastole, the work would become sustainable and effective. We would grow individually and as a team, and we would strengthen and spread this culture of learning and improvement, or love, across the organization. We agreed on about a 3-to-1 ratio. We'd have about 3 systole meetings and then 1 diastole meeting. So every diastole meeting would also have a standard agenda. And the first item would always be this one. This is the talking story prompt. We would ask, does anyone have a story about an experience at Lynn Camille Health Center that felt meaningful and how it affected you and or your patients or team members? And we agreed to use what we called talking stick rules. So we literally have a little talisman, a stick usually, and whoever has the stick is the one who gets to speak. And everyone else's job is to listen generously, not to compare or formulate your response, but just to truly give this person your full and undivided generous attention. And then when they're done, they would pass the stick to whoever else wanted to go next. It was, we were not supposed to ask questions or offer advice or really respond, though we were flexible around that. But the idea was not to fix after somebody's story, but just to really listen and listen to each other. And as an example of the kind of story that emerged here, one of our nurse leaders was Cambodian, and she explained how she was giving a flu shot to a middle-aged Cambodian gentleman. As she was talking to him, it came out that he was a teacher. And she paused and she asked him, if you don't mind me asking, how is it that you made it? How are you alive? Because at the time, at his age in Cambodia, the Khmer Rouge had generally eliminated all of the professions of this class. And so it's sort of a miracle that he was here. He shared that he disguised himself as a laborer for many years and then escaped the country. And at this point, my nurse leader colleague got tears in her eyes, and she shared that actually her own father had been a teacher and had escaped in the same way and it was the only reason she was there. And she shared how even giving a flu shot at Lynn Community Health Center was so deeply meaningful. She was serving a community. It was like she was serving her own family. Now, there were a number of Cambodian leaders actually in our leadership group, because this is one of the communities we served, and they all had tears in their eyes as they connected to and reflected on this experience, but they included all of us in that. We all shared that moment, and you can imagine story after story like this and what it might do to the cohesion of that team. After talking story, we would then learn something together. So this is an example. We spent some of our time doing the marshmallow challenge. Some of you may have done this. You try and create a freestanding structure with spaghetti sticks, a little bit of tape, a little bit of string, and the marshmallow. And there's some lessons around tri-storming and around team dynamics that can emerge from this. And so, this is the kind of balance that would occur in a Diastole meeting at Lynn Community Health Center. So anyways, I want to leave you with this question that Dan Hunt left with me. What does professional diastole look like for you, for your teams? How do you hardwire this into your day so it's not something that happens on your golden weekend or on your vacation, but something that happens every day, little sparks of meaningfulness, of reflection, of growth, of reminding you of your core values and why you're here. Okay, tip number 3, foster relational trust by reducing the vulnerability of others. I'll start this one off by just sharing a parable from David Foster Wallace that he shared in one of his now well-known commencement speeches that you may have heard. But it's a parable of two fish, younger fish swimming along in the water, and an older, wiser fish swimming by who leans over and says, morning, boys, how's the water? And keeps on going. And these two fish swim for a little while longer. And then one looks over the other and says, what the hell is water? What's he talking about? And of course, in the context of today's talk, the notion of water is the notion of our exquisite sensitivity to the psychological safety of this current moment. We have evolved to connect our ability to sense whether somebody really means what they say, whether I can trust somebody with our very survival, with our family's survival. We are exquisitely sensitive to this, even if we don't notice that we're being sensitive to this, even if we don't realize it. But if you think about all the different environments that you travel through in a given day, your work environment, the different people at work, the different contexts of those teams, your family dinner table, your sports team, your friends, you show up differently in each of those environments, really commensurate with how you perceive the temperature of that water to be. Culture really matters. So if we accept that, how do we then impact the temperature, the safety of that water? And I'll offer here the concept of relational trust, which was introduced to me by Tony Breik, who's the president of the Carnegie Foundation, and really refined this concept in his work in the Chicago Public Schools and creating relational trust across a school community. Tony was the wizard, as we call it, at the Health Professional Education Summer Symposium, or annual think tank for educational improvement leaders that I've really been so grateful to be part of. And the wizard's job is he's someone from the outside who's brought in to challenge the edges and the center of our thinking. And he had this quote during one of his sets of remarks that I never forgotten. I wrote it down and I share it with you here. He says, in order for relational trust to flourish, it is incumbent upon those with more power to reduce the vulnerability of those with less power. You have to make yourself vulnerable. Your own vulnerability invites the vulnerability of others, and this is what propagates relational trust. So, so how do you do that? One of the ways you do that, I think, is to carefully examine how you project power. So these are just a few, again, personal examples. I'm sure you have better examples, and it's really just to prompt that reflection. So I really try to emphasize that, when I ask people, please call me Pat, call me by my first name. I offer them my personal mobile and invite them to call or text anytime. When I meet with them in our one-on-ones, or especially the first time, I really strive to meet in their space where they are in control, where I take the time to go to them. And I usually begin by just saying, I always like to start with relationships. Please tell me about yourself. And I take out my notepad. I always travel with this small little notepad that I can write on. And then I listen, I take notes, I ask follow-up questions, I learn about their family and aspirations. And then afterward, I record some of these key points in the address book entry I have for them for quick reference, so that when I see them again, I can check in, and then I can remember the things that stood out to me and check back in on them if it's appropriate. When we meet in my office, I try to come out from behind the desk and sit in a circle where we're open to each other, where we're more vulnerable to each other. And then in my office, you can see this picture on the left-hand side. You see pictures of my family, of the One Trunk Many Branches painting that I shared a slide of earlier. It just sort of quietly sets the tone before every meeting, or sometimes I may deliberately, if someone's for the first time, introduce my family and these concepts to them. And it sets the tone that you matter, you're welcome here. This is a safe space. Okay, tip number 4, making sure the right people are in the right seats on the bus. And there are concepts within here of hiring, coaching, and transitioning. So how do you sort of really shape the team around this? And so, if you're buying into this notion that the way we treat each other every day is the culture and forms the basis for all that we do, then I would offer that we should hire not just for excellence and experience, but we should hire for kindness. We should hire for teamwork and collaborative, values. We should hire for growth mindset. And so I offer to you just 3 of the questions that I don't always use, but I often use when I interview folks, especially these are tailored to clinicians. And I should say as a caveat that oftentimes by the time I'm interviewing somebody, I'm not the first in line in the interview, and candidate has already been carefully vetted for their qualifications, for their experience, and so on. So it is already someone who I know, could do the job. Now we're looking for fit. And so my first question is, if I were to have the privilege of speaking to some of your patients, and they were to be completely open and honest with me, what would they say about you? And then I just listen, and I listen for kindness, amongst other things. And then I say, what about your team? Everyone who contributes to the care of the patient, not just the doctors, but the person who transports your patient and is with them in the cold hallway while they're waiting for the CT scan, the person who cleans their bathroom, who draws their labs, everybody on your team. What would they tell me about you? And I listen for teamwork and for collaboration. And then sometimes later on the interview, I'll say, I have a bit of a different question, if I may, and I'll ask, if you could teach a child 3 things, what would they be and why? And this is often a question that someone has not heard before, and I get to watch them pause. I get to see how they respond to this new prompt, whether they can speak from the heart. And I listen for emotional intelligence and growth mindset. But perhaps even more importantly, quite often, it creates a moment of deep connection with the candidate, because they will speak to what matters most, what they learned from their own parents, from their own mentors, what they have found has made their lives what they would wish and brought them to this moment, and what they choose to share, what they would pass on. So I found it to be a question that I've come back to again and again. So what about coaching? So coaching, I find, is both the expectations that are set up, and then the way that someone is sort of given opportunity to realize a gap between what actually happened and what they intended and what the goals are. And so very early on, before there's any need to coach, I'm very transparent about the fact that in our work, only 2 things we do truly matter. The first thing is to do everything we can to help our patients be safe and healthy. We must do everything we can for our patients. That's thing 1. And thing 2 is to do everything we can to support each other and help our team be successful. These are really the only 2 things that have true value, that are transformational to our patients and to our team. Everything else may be things that we have to do, or perhaps we don't have to do, and we can improve and get rid of them and focus on doing more of what we really want to do that matters. And so I share with people, as long as you are trying to do the right thing for the right reasons, I will always support you. I will always support you. If the result wasn't what we expected or wanted, then that's a learning opportunity. And we'll pause and ask, well, let's see, what could we have done differently? And so I signal this again and again. And then when it comes up, we can begin from that shared understanding. And it's also, these rules are quite simple and memorable. But this is not a an everything goes invitation. It doesn't mean that there isn't some sort of accountability or containment to make sure that we're really doing this. And so I come back to Ed Hundred, who once, with an Ed twinkle in his eyes and a wry smile, shared this quote with me that sometimes, Pat, you have to either change the people or change the people. And so I will share that, and this is extremely important, that if someone's actions are repeatedly detrimental to patient care or team cohesion, and they are unwilling or unable to change, even though they've been given every opportunity really to see that gap, to try to develop insights into why that might be, to have an opportunity to coach with feedback and improve. If these opportunities do not successfully create the change, then it is my responsibility to help them be successful somewhere else, because our patients and our team are too important to look the other way. Now, this is much easier said than done, and is a way that I think perhaps not all leaders go all the way to this point, but I think it is vital, or the rest of the words become just words. So the effect of this is that the bar for respect is very high, and no one is exempt. No one is too valuable, brings in too much money, has too much prestige, et cetera, to be above this principle. One subtlety here is that in many cases when I coach, I begin with the knowledge, I know you were a good person, you were a good physician, your intentions were good, I know that, right? But in the space that we're talking about, the way that someone else experiences you is what determines how they feel about the interaction and how they will relate to you in the future. We must take ownership over the effect of our actions and words, not just our own intentions. It's not enough to have meant to do the right thing, especially as you go up in leadership. You must take ownership over the effect and the experience that others have of you. And so that's a key subtlety that almost always comes up as I coach physicians through some of these challenging deep insights and reflections. And oftentimes, I will share, this doesn't always work, but it often does. It's not a I don't ascribe to the notion that people can't change. I think it's often the case that we have not coached effectively. So I take the time to hire, to coach, and to change people when needed. And no one else will do this if I don't set the tone. So it's really important. If you want this to work, you have to hold the line ultimately as the leader in your area. I will share, a most recent example that has really helped me kind of open my eyes actually to how this directly converts to our work and helping our patients and saving lives. And so before being at One Brooklyn Health, I was the chair of medicine at Mass General Brigham Salem. As Elka mentioned at the start, we carried the highest COVID inpatient volume of all community hospitals in Massachusetts. But in the 2 years prior to COVID landing, in doing this journey of working with the leadership and seeing who wanted to lead this way, who could lead this way, in the end, we transitioned 7 of the chiefs in the Department of Medicine, including hospital medicine, critical care, the residency program, infectious diseases, some of our core areas, and then COVID landed. And on a daily basis, with this team in place, working in a one-track many branches fashion, we achieved daily shared mind, sometimes more than once a day in a series of huddles, and then transmitted that effective high-trust communication with our teams, the same core message, anchored to the same core principles. And this created both psychological and physical safety. The number of our own staff that ended up being infected was relatively low. And this sort of flexible lean thinking, continuous improvement, hundreds and hundreds of check and adjust cycles as we continue to iterate. And in the end, over 2,100 patients were discharged alive with COVID from our hospital, about an 8.5% overall mortality rate, against the background at that time for those early parts of the pandemic of about a 20% mortality rate in the literature. So we could reflect back and count in lives saved, the effect of leading together in this way of creating the one truck many branches environment in our department. And this anchors my internal clarity around why this really matters, even when it's difficult. And it is really difficult to change the culture in this way, but it delivers the outcomes that matter the most. So finally, and briefly, I will speak to administering policies with kindness and common sense. I will say that rules of the road and standard procedures are very important. These are safeguards, and they help set an important bias, and also they're foundational to improvement. I think it was Taiichi Ono who said that without a standard, there can be no improvement, right? Otherwise, it's all variation, and you're just creating more variation. You have to have a standard and improve from that. So I'm a big subscriber to this, but inevitably, there are situations the rules do not adequately cover. They're not meant to cover every contextual situation. And so taking the time to really listen and consider in each case whether the rule should be waived or amended can really demonstrate to people that people really are the bottom line. The active listening is an important adjunct to this. And this will send the message that standards really are in service to people and their shared purpose and not the other way around. That's just one of these examples. And underlying that example of administering policies is a core principle. This is my last content slide. And the second slide that I would say, if you remember nothing else from this talk, the active listening talk, a slide, and this one, this would be the other. Please remember this slide. So the idea here is that every single interaction we have with another human being results in two sets of outcomes. One set of outcome we could call the process outcome. Did we get the right diagnosis? Did we make the right decision? Do we have the right understanding here? The process outcome, it matters. And sometimes, when we're coding a patient and I just need you to push hard, fast, and deep on the CPR, that is life-saving, and I'm going to be very directive, and the relationship outcome come a second. But in the vast majority of cases, the other set of outcomes, the relationship outcome, matters far more. The relationship outcome is how the other person felt about our interaction, how much trust was gained here. What is the sense of safety? How much more do they want to work with me next time? Will they speak up next time we work together? The relationship outcome is critical and builds and is ultimately what creates our culture. So learning to always notice and think about the relationship outcome, to hold this up and be willing to flex on the process outcome when appropriate, as in administering rules and regulations, for example. Ask yourself, will this interaction strengthen our trust and our desire to work together in the future? One correlate, and there are many correlates, but one correlate is never miss an opportunity to praise or thank someone. So I'll share a brief example. Recently, during our COVID surge, and this may have occurred in your areas as well, there was a national shortage and a local shortage of butterfly needles. And as a result, our phlebotomists and our techs were often out, and our residents were left to draw bloods a lot of the time, unfortunately, in the peak of the Omicron surge. And without the butterfly needles, they were drawing them sometimes with straight needles or ABG kits, and these were more painful to patients, took more time. So a real issue. The residents were really frustrated by this. It turned out that one day, we got wind that these might actually be physically in the building, just not being stocked in the areas where our residents are working in the emergency department. And one of the ED administrators confirmed this and helped direct us to the place where we found the needles and brought them up. And so a colleague and I were talking about what to do next, and we were really left with these two choices, this sort of idea that we might be frustrated to say, this was your job, right? How could you leave our residents to struggle and our patients to suffer when these needles were in the building and you should have stocked them? Why didn't you do your job? To think that and feel that and maybe transmit that in some way, verbally or non-verbally. But the other choice was to not miss the opportunity to praise or thank, to say, go back and make the point of saying, thank you so much. I wanted to understand how much this matters to our people and our patients, how much I appreciate your partnership. All of us are under a great deal of strain, and the fact that you stepped up to help us here really mattered. Thank you so much. And we took the latter approach, and it built increasing goodwill. It invests relationship. It really propagates forward, and it really costs us nothing. The work has already been done, but how do we then never miss that opportunity to praise or thank? So this is just one example of how, when we think about the relationship outcome, we might actually change the way that we navigate through the daily interactions that we face. I encourage everyone who has a teaching or leadership responsibility to not only learn this, but teach this to the people who work for you. Coach this in, and imagine the power of everyone in your organization, especially as they go up the ranks of influence and power, treating each other with this kind of kindness and respect, reducing the vulnerability of others, creating relational trust. And I would offer that this is how we change the culture. This is how we harness the true power of our people to improve the lives of our patients. And so in brief summary, we've talked about why love matters, what that looks like in organizational terms. We've talked about focusing on the people, what it looks like to develop a culture of professional dastardly, how we might foster relational trust by reducing the vulnerability of others, how we work to make sure the right people on the right bus, right seats on the bus by hiring, coaching, and transitioning people effectively, and then how we administer policy with kindness and common sense, and always learn to hold up the relational outcomes and not just the process outcomes in a given interaction. And so with that, just want to say an enormous thank you for the privilege of being here with all of you. Thank you for the invitation. Thank you for putting up with this sort of long monologue of a personal journey. I hope some of it was helpful, and I hope we have some time for a few questions. Thank you so much.
Thank you. Another virtual round of applause. That was absolutely fantastic. Thank you so much. Elka, would you like to lead us in monitoring some of the questions?
Sure. Firstly, I'm just going through all the praise. There's so many comments of appreciation, of thank you, and wanting to know if we can record this. And I'll read this one particular. I don't know if there's a question at the end of it, but I think it's worth repeating if I could. Someone wrote, Melissa Philadelphia, love is powerful. It's always been in our personal lives. The challenge is to extend it into our professional lives and for it to be perceived as a strength and not a weakness. I don't know, Pat, if you would just comment on that sort of beautiful sentiment.
I agree, and I appreciate the sentiment. I started the talk by sharing a bit about the 8-year personal journey and repeated failures of trying to find my voice around this, find a way to put it down in words in a way that someone would think wasn't just drivel. And it took me 8 years and to really come to own this and be unashamed and actually completely out in the open, to hang the one trunk, many branches on the wall is the first thing when I enter a new office. It was a journey, and it wasn't easy. And I think there are a lot of, we could say, hidden curriculum forces that urge us not to do this, that tell us that this is not the way, or that make us feel vulnerable, or that actually show us that we are vulnerable, right? And if somebody above us doesn't lead this way and sees us as threatening or strange, we can suffer the consequences. So this is not easy to do, and yet, we know in our hearts that it's hearts and then head and then hands. This is always the way, and we should lead this way.
Hearts and that's somebody in the chat related to the lack of kindness and love to burnout. I wonder if you might comment on how this is related to our experience of burnout and demoralization in a very tough moment in time.
Yeah, absolutely. Absolutely. And the thought that comes to mind is this recent characterization of the notion of moral injury, or a sense of dissonance that we have, where what are supposedly the values, what should be the organizing principle, what should be the trunk, we don't see that happening, in the actual workplace. And in fact, we are led to be complicit. We're torn between our Hippocratic oath and what seems to be unfair, unjust, and we are part of that system, and it eats away at our souls. And so one of the opportunities to lead with love, to show in the way that you use your time and the way that you respond to key decisions, the way you communicate, who you choose to hire, how you hire, and so on, is that it begins to create more consonance in the trunk, and the words in the wall begin to mean something. Also, in a very specific way, things like diastole and teaching the diastole. When I attend on the wards, I have a little one-pager where we go through a range of things, my expectations, choosing wisely, various things, but I always include diastole, and I make a point to use diastole, and I want folks to come up with just one of those habit stacked ideas. Something you have to do, your active password, waiting for the elevator, looking at the telemetry monitors, whatever it is, and wire to something that you want to do, and share your idea with me, right? So I find that diastole is quite protective against burnout. It's not a silver bullet, but if intentionally multiple times a day, we are reconnecting with the core why, and then potentially as teams in the top of our meetings or in these sort of monthly Downstate sessions with the residents and so on, we are introducing structurally, intentionally, those connection points, never losing the thread, as William Stafford urges us to do. I think this is somewhat protective against diastole, and all these things together, of course. The more of us who lead in this way, are given permission and safety to lead in this way, the more we create that environment. The COVID response in Salem was hard, really hard, as it was, and nothing compared to what we had here in Brooklyn, as I acknowledge the volume, but it was hard. But our teams felt safe. They didn't feel burnt out. There was fatigue without burnout. And I can't give you a linear relationship to what caused that, but the overall culture and environment contributed to that sense of safety and that protection from burnout.
Wonderful. I have one more question, if I could, from the chat, from Alistair Thompson. Really great talk. Thank you. You evidently have a lot of strength in relationship building as a leader. How might you suggest a leader shows kindness and trust if they have strengths that might lie elsewhere? For example, in strategic thinking or achieving goals.
I think these strengths are essential, and I have two thoughts here. One is, if we want the impact and scope of of an approach like this to have the greatest possible reach, then we must marry it to strategic thinking. We must think about ways, for example, to measure respect for people. As I mentioned in this sort of comment about the Relational Coordination Index, we should think about strategic goals. We can think about culture of safety goals. We can think about coaching goals. We can think about ways to accomplish the inputs and the outputs and the outcomes to lead up to the impact of a safe culture. How do we message that? What are the visuals? What is the environment? Everything speaks. There are many ways we can think operationally and strategically. And if we agree in principle, we can leverage our strengths to amplify and really increase the impact. By the same token, I would offer that I believe all of us in leadership are here because there is a recognition of a level of emotional intelligence. If we are effective in our roles, if we manage people in our roles, we have already learned a lot about what it takes to work with human beings, to work with the human side of change. And I think there are ways to take certain techniques like active listening and learn how to do that, and learn how to do that really well. And even if in your mind you're working through the steps, it's sort of like we taught how to have a goals of care conversation in a very structured way in a serious illness communication structure. And so even if you're working your way through the procedure in your mind, the effect on others, I think you will find, is what you would wish. And so we can begin to build a toolkit and learn some of the essential things. So this framework of process and relationship outcomes, we can learn this, practice this, and teach this. So there are ways to really lean into this in a way that leverages perhaps perhaps system thinking, process thinking, strategic thinking, and contributes meaningfully. You don't have to be as wordy as me or write a poem about Diastole. I think there are others who, within the invitation and the right culture, will come and do that, and we can use our own colors of the paintbrush to build this one trunk, many branches. I hope that speaks to the question, and if I was off the mark there, I'm more than happy to try again.
The response was yes, you did answer it, and there was appreciation. I was going to leave it, but there was one other question that I would, I think is quite important to address if you could, and then perhaps we'll all break for lunch. So this is I'm going to just read it out rather than parse it out. I wonder if you can comment on asking for vulnerability when the two parties are at a power differential. I've had bosses with whom it might feel uncomfortable to be vulnerable. I'm sensitive to the fact that a supervisor sharing details of their life is not being as vulnerable as a trainee, but I see the great value of making those personal connections. How do you balance respecting people's boundaries while fostering personal relationships in the workplace?
It's a really important question. It's a really important question, right? It's like, it's not a, I'm going to show you mine and you must show me yours kind of thing. Right? It's really important that the expectation is not that somebody matches my level of vulnerability, but that I share the invitation and repeatedly. You know, I will, as a very low stakes example, many of the international medical graduates in our residencies, when I say, please call me Pat, they'll just say, I can't. There's just no way, right? And they appreciate the invitation as I explain why that matters, that the hierarchy isn't so helpful if it means that they feel a barrier to speaking up, that what I want is that they will help transform the lives of our patients and transform the quality of our teamwork. That's what matters to me. That's how you show respect to me. And so I want you to feel you can reach me whenever you need me, right? Please call me Pat. But if you would like to call me Dr. Lee, I'm okay with that, right? But I want the intention to be clear. And so I will certainly let somebody choose and try my best. I'm sure I fail sometimes, so I may feel pressured, right? If I may I share my mobile number with you, for example. Most times people feel that they want to share the mobile number with me. And most times my read is that it doesn't feel like they're doing it out of obligation or reluctance, but I'm sure there are times that I miss the signals, and they are. So it is I think your response, Elka, to one of the questions you were asked, I will share here that this is hard. This is difficult space. And as a human being, I'm sure I will fail sometimes, but I try to be sensitive to that. And it's very clear that it is directional. It's incumbent upon those with more power in the hierarchy to make themselves vulnerable, not those with less power in the hierarchy to go first and make themselves vulnerable. We create the safe space and allow people to come to the table in their own way and in their own time.
I am speechless, which is not a common condition for me. And I thank you on behalf of our school, and thank you for coming and joining our systems and Brooklyn. And we look forward to working with you. I think probably each and every one of us on this virtual meeting hopes that we'll meet you in person and work together in the future. And you've influenced us today. So thank you so much, Dr. Patrick Lee, for joining us and sharing these beautiful stories and prismatic metaphors and very practical strategies as well.
Thank you so much. Please call me Pat.
I shall. And I do have your number that you gave after our first meeting. So that was a very true statement. So thank you all.